After giving birth, feeding and providing love and comfort for your baby is the most important thing you can do. This starts immediately. When your baby is born, he will be dried and placed in your abdomen as soon as possible. This is lovely for you and your baby as he can feel the warmth of your skin, which adapts to keep him warm. He will hear your breathing and the rhythm of your heartbeat, which helps to calm him. Skin-to-skin contact enhances the hormones which help you fall in love with your baby. You coat your baby's skin with natural bacteria to which you provide antibodies in your milk. Your baby may naturally start to look for a feed from your breast, which is instinctive. If you choose to bottle feed, allow your baby to have this first bottle feed whilst in skin-to-skin contact with you. Babies are really keen to feed that first time, and it's usually within the first hour. It is important to keep your baby close. This allows you to recognise and respond to her feeding cues. She will make some movements such as rooting to tell you that she's looking for a feed. It's also reassuring for your baby to know that you're there. If you are both together, then you're exposed to the same bacteria, so you can help protect him from infection as you provide antibodies via your milk. I'm often asked how often a baby should feed, and to help you understand this, I would like you to just take a moment to consider how many times a day that you eat and drink. The average is about 15 times a day, and with that in mind you will now understand that it is normal for babies to feed at irregular times of the day and night. You will notice that some feeds will be short and others will long. In the early days after birth, baby's tummy is really small, the size of a small marble, growing to the size of a ping pong ball by day 10. So it is normal to have small frequent feeds in the early days. Some feeds will be close together, and we call this cluster feeding. If you're bottle feeding, baby will take some large and some smaller feeds. It's only your baby that knows what he wants, and if you respond to his cues, your milk supply will be exactly what he needs. Breast milk is the healthier option for baby. Research shows that if you breastfeed your baby for the first 6 months, there's less chance of him being admitted to the children's ward with conditions such as respiratory infections, ear infections, sudden infant death and childhood cancers. Breast milk is unique to your baby, and it changes throughout your whole breastfeeding journey to provide exactly what your baby needs. It is dose related, so if you give any breast milk, it's better than none. If your baby is born prematurely, breast milk is extremely important, as premature babies are more vulnerable to infection, which can be very serious. Formula milk is unable to offer this protection despite what is advertised. Breastfeeding is very pleasant as you get close with your baby, and the hormones that are secreted make you feel happy and relaxed, and they help you fall in love with your baby. It also has some health benefits for you. Babies are born with reflex which should enable him to feed, and these are usually in place from 37 weeks gestation. You can help the baby attach at your breast by the way you hold him at your breast. Get yourself comfortable, as you may be feeding for some time. If you hold your baby in close, have his head and neck in alignment. Make sure his head is free of restriction to allow him to take his head freely back. When the baby opens his mouth wide, bring him swiftly to the breast. This helps get the nipple to the back of the mouth, which is necessary for a deep latch. The baby will have a wide gape to his mouth. He'll have full round cheeks. His top lip will be tight, and you will see his chin indent your breast. His nose will be clear of your breast, and he should be comfortable. It should be sustainable. You may see more areola above the top lip, and rhythmic sucking and swallowing will be seen and heard. If attachment is not achieved, there will be pain, and your baby may not be able to get the full feed. So it really is important to seek help. There is more information on the hospital website. Now, if you choose to bottle feed your baby, the technique is slightly different. You hold your baby close in an upright position. Looking into your baby's eyes will help build his confidence. It is best to have only 1 or 2 carers, as formula milk doesn't provide protection from infection. It's also important to wind your baby during and after a feed. It's important that you make up feeds as required with water at 70 degrees centigrade. This is because formula milk is not sterile and can be harmful if it's not made up correctly. It's advisable not to store the formula milk in the fridge if reconstituted from powder. Don't worry, you'll be shown how to do this on the postnatal ward using your own milk powder, and so it's important that you bring into hospital a tin of powdered milk, a bottle with a teat and a bottle brush. Please don't be tempted to bring cartons of ready-made milk as we don't have the storage facilities. You will know your baby's getting enough if you can hear him sucking and swallowing regularly. Another sign is he's having full, dirty and wet nappies. Your baby should be calm during and after a feed. Whilst you're trying to establish breastfeeding, it is important to avoid giving supplements of formula milk. The reason is that cow's milk protein is hard to digest, which may upset your baby's gut, leading to sensitisation, and it may also affect your milk supply. Using dummies may mean that you will miss feeding cues and that baby is giving you and sucking on a dummy when he really wants a drink or a feed. This may lead to problems with weight loss in your baby. It is important not to use nipple shields and teats while you're trying to establish breastfeeding, as it is a different way of sucking, which could confuse your baby. Babies only need breast milk or first formula milk during the first 6 months of life. That doesn't mean you have to stop giving either of those milks, but it does mean that your baby needs solid foods after that time, and your health visitor will support you if needed. Occasionally, some babies don't want to feed. It may be they're exhausted after the birth, or they're affected by the drugs used during your labour. If this is the case, you'll be shown how to hand express your milk. The milk could be dripped into your baby's mouth or given by a small feeding syringe into baby's mouth. Please be reassured that however you choose to feed your baby, the staff at York Teaching Hospitals will support you.